But the focus after the Omicron variant has shifted once again back to diagnostics. What's going to happen? Will testing rise again? Is COVID-related testing going to pick up after what we saw? The non-COVID testing actually made a comeback up until about 15-20 days odd back when you did have the first wave of the Omicron virus here in India. So let me welcome on board Ameera Shah, the promoter and MD at Metropolis Healthcare, on the show right now. Ameera, hi, good morning. Great to have you on the show. It's too early, I guess, Ameera, but what is it that you're seeing right now on ground? Is there panic testing like what happened with the first variant as well as the Delta variant, now with Omicron?
Not really. I don't think we are seeing panic testing at this point at all. We're mostly seeing testing for travel purposes and obviously some amount of infections. As we've seen from South Africa, and as Dr. Kotsi from South Africa has said, that what they have found is that even post a Pfizer, J&J or other vaccines, obviously Covishield included, there are reinfections happening between 3 to 6 months after being vaccinated. But those who are vaccinated, the infection is still mild and not severe. And therefore, that is definitely the silver lining. I think as this information is coming out, we're not seeing panic actually, and things are, I would say, reasonably stable. There is an uptick in volume of testing. But that's because we are seeing COVID infection spreading and not so much just out of panic testing.
Right, sure. So what exactly are you seeing right now? Because, what we got from the second quarter update was, Ameera, that it's the non-COVID business which is actually making a comeback, be it for healthcare services, hospitals, all alike. Is the non-COVID testing still forming a large part of your volumes?
So non-COVID testing is the base and the core of our business because it's basically for all other illnesses. And that's what's been the main core of healthcare. So that remains the core. And obviously we should be focusing on all the other diseases much more than only focusing on COVID. Anytime there is an epidemic or a pandemic, it's obvious that one particular disease or infection will get the focus at that point of time. But often we've said as healthcare workers that it's very important that we don't forget attention from the other diseases because they might be shoved under the carpet for now, but they will rear their ugly heads in the future. And therefore, it's very important to keep the focus on non-COVID. We are seeing this quarter that the COVID testing, as I mentioned, has seen an increase. But that, like I said, is majority because of travel and some amount of infection in some pockets of the country. It's still early days. We are seeing in places like Calcutta, in places like Kerala, and in some parts of Maharashtra and Gujarat, we are beginning to see early rises of the infection increase.
Ameera, Alex coming in, just trying to understand from the perspective of running a business where things are changing so rapidly and dynamically. Do you therefore anticipate that there will be a fair amount of lumpiness in the earnings that you report, at least for the foreseeable future? How are you girding for that?
Absolutely, Alex. And look, I think, often in the financial markets, everybody is very keen to write off Corona and that we are done with COVID pandemic. I think in the healthcare world, we see it a little bit differently, where we realize that in a pandemic, this is not going to go away in a year or 2 years, and this is going to continue for a while. Obviously, we are all safer having been at least partially vaccinated, if not all fully vaccinated. And therefore that, like I said, is a silver lining. But yes, from a business perspective, what it does mean is that every quarter, there is an uncertainty and probably not as much of a stability or prediction as, it used to be before. But as we've seen for healthcare companies like Metropolis, this has not been a bad thing. Metropolis has grown really well, whether it's on non-COVID and COVID testing in the past year and a half. And I think that we will continue to keep that trend and that journey as we go forward.
Okay. Could you also give us a sense of how the business is expected to grow in this scenario then? What are the levels that you're expecting? Broad sense, though.
See, I think any numbers, frankly, on revenue growth is difficult to predict at this point of time. Only, like you said rightly, there's certain lumpiness quarter by quarter. I think broadly overall, I would say that if I look at sort of a CAGR for the last 2 years, if I look at the last year to this year, I think we are sort of back to a close to a normalized growth that we used to see, and this is again very different in different parts of India. In certain states where the lockdown has been more severe, restrictions are more strong, we are seeing it taking longer for things to come back to normalcy, even for the non-COVID piece. In some states where the lockdown has never been very strong to begin with, we are actually seeing that, it never got affected that badly. So if you see sort of in 2021, the reduction in revenue in north and east of India was not as much as we saw in west and south of India. We saw more reduction in west and south because the states in west and south, the governments, the administrations, were far more disciplined and vigilant about shutting down the states and taking a long time to unlock. And that therefore did not allow normalcy to come, because we have to understand that for non-COVID infections to spread and diseases to happen, we have to engage with the world. It's only when we step out of our homes and our offices, we meet people in our office, we eat outside, we get infections from each other, somebody has an accident on the road. It's when we live our lives that these things happen, and health becomes something to care about. When you're in your home and protected from all infections, all disabilities, all challenges, there is generally a higher level of good healthcare and lower level of need for doctors. Which obviously directly impacts our business. So I would say overall, I think the next few years are positive. I think we should be back to a normalized growth pretty soon.
Good morning, Ameera. Thanks for joining us. So you're talking about growth normalizing. What we've also seen in recent times is firms like yours and other large diagnostic companies being on an M&A spree. There has certainly been consolidation. You just recently closed one a few weeks ago as well. Do you see this remaining as a trend in diagnostics, including, for a new player like Pharmeasy and what it did with Thyrocare? It seems as if the entire space is up for consolidation even more.
I think to some extent, yes. I think, the direction that things are going in, healthcare is also moving from the traditional brick and mortar space and becoming more digitalized from every angle, at least for the organized sector. We are obviously seeing a bunch of health tech companies come in as well, and this is going to fundamentally change also the nature of the industry going forward. A lot of opportunity, but also things to do differently. And therefore, I think that the organized sector like us and a couple of our peers who are going to be, if we are proactive and we are progressive and we are aggressive about the way we are, there's obviously a better chance of gaining scale and traction and filling up the gaps all across the country, and also consolidating our space in certain cities. And I think both these strategies are important: filling up the gaps in geographies where we don't have strength, and consolidating strength in cities where we already have strength. So my sense is that the consolidation, will continue, whether they are small firms, large firms, difficult to predict. But I think we will continue to see a lot of action and a lot of excitement in our industry for the next couple of years.
Let's see how all of that activity pans out. Ameera, we've run out of time, but the next time we have you here, I would love to have a detailed conversation for you on the health tech platform, whether it's the National Health Digital Mission or the likes of Max Healthcare and Apollo also betting big on digital with their super app of sorts. For now, completely out of time. Thanks for joining us.
Thanks so much.